and I am a senior associate here at the Center for the Study of Social Policy and the coordinator of the Alliance for Racial Equity and Child Welfare. On behalf of the Alliance and CSSP, I'd like to welcome you to this afternoon's webinar, the final for this year's Alliance webinar series featuring a discussion about the intersection of race, housing, and child welfare. Our presentations will begin shortly, but first a few brief and important reminders. We recommend all participants dial into the webinar using a landline to improve your sound quality and to avoid any connectivity issues. If you have any issues with sound quality, please hang up and then dial back in. Sound challenges tend to frequently be due to a bad connection. Questions for our presenters will be answered at the conclusion of all of the presentations. You can submit questions anytime using the question feature in your GoToWebinar control panel. Also, this webinar is being recorded and will be publicly available after the webinar. The link to the online webinar will be shared via email after today's session. Finally, after the webinar, you can expect to receive a brief evaluation survey. We'd appreciate everyone's feedback, both about the webinar and about other topics and questions you'd like to see addressed by the Alliance in the future. Now, on to today's discussion. The mission of the Alliance for Racial Equity and Child Welfare is to promote leadership and provide information in support of eliminating racial disparities and improving outcomes for children and families of color who become involved with this nation's child welfare system. One of our primary goals is to help individuals and organizations further understand the nature and the extent of the racial disparities we see in the experiences of and in outcomes for children and families. While the Alliance continues to highlight the extent and nature of disparities, we're simultaneously interested in understanding how well children and families are doing and, drawing on the language and the experience of the institutional analysis methodology, how well child welfare and other human service systems are organized to support families who are experiencing various challenges. And one of those persistent challenges we're interested in today, and that we know disproportionately impacts families of color, is the challenge of housing instability and homelessness for families and involvement with this nation's child welfare systems. I also want to briefly highlight the broader context in which our conversation today is happening. Analyses done by Pew Research Center and other institutions reveal that since the recession around 2008 and 2009, wealth inequality has increased along racial and ethnic lines. The wealth of white households was 8 times that of black households in 2010 and 13 times more in 2013. Similarly, the median wealth of white households was 9 times that of Hispanic and Latino households in 2010 and 10 times more in 2013. Black households experienced over a 33% decrease in wealth, with Hispanic and Latino households experiencing a decrease of over 14%. The size of the racial gap in household wealth is the largest since 1989. Moreover, despite the economic recovery in this country, families of color are less likely than whites to own their own homes, with rates of home ownership among families of color actually decreasing in recent years. Multiple analyses also reveal that African American and Latino borrowers were far more likely than white borrowers to lose their homes to foreclosure. And there's at least one more trend that we think is worth noting. Despite the increase in construction and an increase in the overall number of housing units in this country, and despite a growing vacancy rate with those units, apartment rents have risen nationally for 23 straight quarters and are 15% higher than they were at the end of the recession in 2009. Analysts also suggest that this long-term squeeze on renters is still not letting up. These wealth and household trends, coupled with persistently higher unemployment rates among African American families, Native American families, as well as, albeit not as extreme, Hispanic and Latino families, helps us to understand the societal context we're talking about today. Therefore, many of the families and communities we're talking about for many decades were excluded from the wealth-building home ownership process, and while they have been included in more recent decades, they have also been exploited and preyed upon in that very same process. As a result, these are also families who don't have a financial cushion, if you will, to lean on and get them through financial and otherwise hard times. We believe it's important to set this context as the dynamic of race, housing, and child welfare that we're talking about today is directly related to our societies and certainly the Alliance's broader conversation about institutional and structural racism, its impact on the lived experiences of children and families throughout this country, and also its impact on the systems that are charged with supporting them, especially, although not exclusively, child welfare, housing, mental health, and the like. So with that context, I'd like to introduce our guests and presenters for today's webinar. To share their experiences and perspectives, we've invited 3 individuals who are very familiar with these dynamics from both policy and practice perspectives, as well as the daily lived experience of children and families. Ruth White is the Executive Director of the National Center for Housing and Child Welfare and has dedicated a great deal of her career to supporting child welfare and housing systems in their efforts to meet the housing needs of children, youth, and families involved with child welfare. Jasmine Hayes is the Policy Director of the United States Interagency Council on Homelessness and has also supported related efforts within public child welfare settings. Tashira Halyard is the Deputy Director of the Homeless Children's Playtime Project here in Washington, D.C., and is an attorney who has represented children in the child welfare system and also worked for a brief period of time on systems and community change efforts here at the Center for the Study of Social Policy. We appreciate each one of our guests here with us today, and we also appreciate all of you for joining us today, and we look forward to today's discussion. We'll now ask Ruth to get us started, followed by Jasmine Hayes, and then Tashira Halyard. Ruth?
Well, thank you, Orande. I should mention that it's an honor to be here presenting with you. I've known Orande now for a long time, and I've followed his career, and I think that he's done a great deal to change the child welfare narrative across the country to embrace these issues and to take a more serious look at what we can do together to reduce the overrepresentation of youth in foster care and in juvenile justice confinement. So, Orande, I really want to thank you for including me in this. And it means a lot to be with my fellow presenters as well, given their rich backgrounds in child welfare and housing and homelessness. So with that, I'll get started. The National Center for Housing and Child Welfare is only about 6 years old, but the body of work that we formed into an organization began long before we formed this organization. Started at the Child Welfare League of America, and we pulled all of that great work that they've done for over 20 years to bridge housing and child welfare to create an organization. And our mission is twofold. It's on the one hand to ensure that no child ever enters foster care needlessly as a consequence of their parents' inability to afford safeties and housing. And the other half of our mission is to ensure that every young person who ages out of foster care has access to safe, decent, affordable housing. And we try to get at this working on 3 levels simultaneously. This is, I guess you would call our theory of change. It's based on diffusion of innovation theory. We work on the policy level to ensure that our public policies create the kinds of resources on the ground that are needed to keep families together and safe. And part of what we did was help resurrect a 20-year-old program called the HUD's Family Unification Program, which I'll talk more about later. And currently there's more than $50 million of Section 8 vouchers in operation for families to keep them together and safe. We also work on the program level because we have to make sure that city by city, child welfare commissioners, child welfare leaders, and folks that hold the housing purse strings are working closely together to free up resources across systems. And then finally at the practice level, so that frontline child welfare workers know that they're not alone, that the community is working on their behalf to free up resources, and that they should have good working professional relationships with folks in the housing community, whether that be at homeless shelters or public housing authorities or at other ancillary service providers. And everything that we do, we approach with a housing lens. So we always want to make sure that affordable housing provides that solid base for families and children to thrive. So to be asked to be part of this webinar is very important to us. It's an important platform because our research and the research that we've pulled from other folks definitely shows that housing is a major contributor to the overrepresentation of children in foster care. And the Government Accountability Office actually provided us with a context that's not too different from what Orande very kindly shared with us to kick this off. So I want to talk a little bit about the GAO study in 2007 that looked into the overrepresentation of minorities in foster care. They pulled together data by talking to stakeholders, and they also offered some recommendations. So this first slide, I can't imagine that there's anyone on this webinar who hasn't familiarized themselves with the GAO study that was done in July of 2007. And so this is partly why you dialed in, I'm sure, for this webinar. This shows the disproportionate representation of young people of color in the foster care system compared to their population in the U.S. I think it's something like 18%. Here it says 15% of the general population in the U.S. Are African-American children, and the rate of foster care placement is close to 34%. We've done a number of things in this country to bring this number down, so this is a little bit not as out of whack as this slide purports, but there's more we can do, and part of that I hope to contribute today is, there's more that we can do, and I think if you take a housing approach, we can help bring it down even more. So the next slide. Now these are the things that the GAO brought to light by talking to academics, child welfare practitioners, and policymakers and other stakeholders to get a sense of what would be the contributing factors. And so this is the state's view on the poverty-related factors that drive children at a disproportionate rate into the child welfare system. And you can see that the largest factor that they identified was poverty itself in African-American communities. Then there's a large number of single-parent households, which of course can contribute to the poverty. And then there's this high rates of substance abuse category, which is the third category down. And I have to just take a moment to divert off of my slides to say that there's a disproportionate there's an issue here with substance abuse of a disproportionate ability for families in the African American community to access substance abuse services, but the GAO probably shouldn't have used this, I'll just say that. There is not a disproportionate rate of alcohol and illicit drug use, okay? So when you look at illicit drug use among the African American, the 2013 numbers just came out where they surveyed the American public on this. So SAMHSA and the GAO should maybe sit down and have coffee. What SAMHSA found is that there is a statistically insignificant difference between the illicit drug use of African American households and white households. When you look at alcohol use, white families blow black families out of the water in every single category. So when it comes to alcohol use generally, it's 58% of white families have alcohol use in their households. It's only 43% for African American. And when you look at heavy binge drinking and heavy drinking, whites are much more likely to be involved in that at high rates. So I would say that that's not true. This third category is not true. It's access to those services, which is appropriate for my presentation because what I'm really going to drive at with the slides I have left is the match between services and needs is what is driving this lack of ability of child welfare to match adequate services with the needs that are revealed through their assessments and their engagement with the families is contributing seriously to the youth in foster care. And that third line on the chart is an example of that, not that African Americans are using at higher rates. So next slide. So here they look at different kinds of support and preventative services that can, the lack of access to these can act as a barrier to keeping kids with their families. And you can see that the first thing that they mention here is a lack of affordable housing options for African American families. Then we have a more accurate line here that says lack of access to substance abuse treatment, and then the next line down is kind of more generic category of access to support services. So they've now raised affordable housing as the biggest problem, okay? So next slide. And again, we have this issue of why can't kids return home? Why can't we send them back? And again, the number one reason is because of a lack of affordable housing options. The next one down is very interesting to me because I'm going to demonstrate on my next few slides about the fact that we have a services matching problem in child welfare, so workers just don't have access to the right resources to help families. So I wonder if this next line here that says distrust of the child welfare system within the African American community isn't as much, we call it distrust as experts on the child welfare side, as something more like pragmatism. So African American families are looking at the child welfare system saying, okay, you're assessing me for all of these issues and needs, but you don't have the right tools in your toolbox to help me. Why? It's not that they don't trust you. They're making the pragmatic judgment that you can't help me. So I disagree with that. I think that second line is also related to the lack of services, lack of affordable housing. Next slide. So now I've just shown you like 3 slides. There's really not that many of these charts in the GAO study. Out of, say, 5 charts, 3 talk about housing, affordable housing. So now let's look at their recommendations. And again, who do they talk to get these recommendations? They talk to child welfare practitioners, academics that research child welfare, and they talk to stakeholders. So here's the recommendations. The GAO suggested that Congress consider amending current law to allow subsidies for legal guardianship in order to assist states in increasing the number of homes available for the permanent placement of African American children. Not reunification, not prevention, legal guardianship subsidies to remove children from their birth parents and place them in, albeit kinship care, but place them away from their parents. So the GA also recommended that states get better data. They also recommended that child welfare should coordinate supportive services. And however, they did not suggest that there be increased access to affordable housing for birth families, or that child welfare money, for that matter, would be used in that way. So I think that's interesting, because what you could say is, well, that's what they mean by supportive services, right? Okay, but let's look at that if you go to the next slide. This is the slide I showed you earlier where they say the views on high entry rate into foster care. The first thing is lack of affordable housing. The next thing is the substance abuse issue. And the third is limited access to family support services. So the GAO, in studying this, separated out affordable housing, and then yet they neglect to offer that as a recommendation. It's sort of, I don't know, an active omission or something, commission, I don't know. So we feel that we can do better than that the United States can do better than that. So next slide. So what I'm going to offer, hopefully briefly, is a way to reduce, again, not altogether, but to contribute to a reduction of disproportionality through an investment in affordable housing. And we call this a pragmatic approach because it's not anything that is unusual. We put child welfare workers in the position of asking an inordinate amount of questions. They have sometimes the NCFIS, which I believe the North Carolina Family Assessment Survey, which is something like 10 pages, half of which is the kinds of things that Arande referred to: wealth, income, environment, neighborhood quality, and housing, and yet we don't offer them any tools to help. So we're just simply saying match the services up with the assessment forms. So we feel like it's very pragmatic, and we think that more African American families might actually engage in services if they knew that those services were going to be helpful and available. So the next slide. Now this is kind of sad. So HHS did this great study. It was one of the clearest reports they ever issued, and they haven't actually issued it again. So this was the 1997 study, and what they found was that child welfare agencies have a very difficult time matching services to need. I cannot think of a more difficult job than to be a frontline child welfare worker. Okay, to wake up every day and to know you have to get all this information from these families, sometimes very basic questions, and you don't have the tools to help, right? So it would be like a daily exercise in futility. Well, when they looked at this, HHS found that they just have a very difficult job dealing with poverty-related services, which is a real problem because, as most people know, they're dialing in for this webinar, poverty is the best indicator of whether or not you're going to be involved with child welfare. And at this point, we're removing children due to neglect at a rate of 80%, and the sexual abuse, physical abuse, and so on and so forth is closer to 13%. So neglect and poverty are very prevalent, but yet we don't give the workers what they need. So they have a terrible job try to match all kinds of services. But housing was the most difficult one for them to match to need. However, when you look at whether or not that service was matched to the need, race was the best indicator in this study. Now, has this changed today? Perhaps, but be that as it may, these are the disparities. More black families than white families needed a housing service, but of the 25% of Caucasian white children needing a housing service, only 35% got it. So they didn't do a good job with the white families either. But when you look at the African Americans, 60% of the African American children needed the service, and 80% failed to receive it. Next slide. So this offers all of this on a handy chart. These are included in the study. The study's not that easy to get. I have a PDF of it. I don't think that's available on the web. I'd be happy to share that with anyone who'd like to see it. I'd like to make an appeal to HHS to do this again. Again, it's very easy to understand. The chart that's the largest on here, or the piece of the pie, is that services were not offered when they were needed. So for the African American families, it comes up to about 80%, and so on and so forth. But here's what's interesting. Oh, I actually took out that slide. So go to the next slide. So we've established that the housing services are very difficult to come by for African American families, even though they would be very helpful. And it tends to get worse. Housing tends to exacerbate things for families all throughout. This is for all families that are poverty-stricken or dealing with homelessness. It exacerbates their child welfare experience all the way down the continuum. But if you look at the studies on race, it's the same thing. So like African American children are more likely to be identified. Once identified, they're more likely to be reported. Once reported, they're more likely to be substantiated. Once substantiated, they're more likely to be removed. And then once they're removed, they're among the longest stayers in child welfare. That is exactly the same research that that comes to light for housing. Housing makes things very difficult. And you can think about the logistics of this. If a child is in foster care and the mother has met all of the requirements, but is sitting in front of the judge and is living in a car, even if your state, and many state laws actually do say you cannot remove children or keep them out of their household because of homelessness, okay, but that doesn't help a judge who knows he's rewarding a kid, he's going to award a kid back to a mom who's living in her car, okay? So we have to think about how we can use our resources differently. But that's why they end up staying long. And actually, housing is a better predictor than substance abuse for whether or not a child's going to stay in foster care. So that's just a little bit on that research. But what's interesting down here is this 30% number. About 30% of the kids in foster care are there because of housing problems. And then housing, again, it poses a very difficult obstacle for child welfare workers, and we have to do a better job of getting them what they need. So the next slide. So there's this argument of housing and the housing crisis, as Aronde described it, housing discrimination. All of these different factors of housing are wrong, and they're wrong for a lot of reasons. They're wrong for moral reasons and so on and so forth. But it's also really expensive, you know. So if we just want to look at the bottom line, keeping these kids in foster care as opposed to keeping them with their families is really expensive. So we just completed a cost-benefit analysis that I'll talk about on a different slide. But this is one that we did in 2004, and it shows that if you were to reunite kids with their families and just outright pay for their housing, this was actually done with Section 8 vouchers, you would save $134 million. And then this issue of youth, if you have a homeless youth, it's a tenth of the cost to just provide them with housing than to leave them on the street. So there's kind of a mercenary issue there, but be that as it may, it's cheaper. Okay, next slide. So we've established, I guess, to some degree, that housing is important. It would be cheaper and smarter to do this differently. So what could child welfare begin to do? Well, I say first and foremost, we need child welfare to acknowledge the difficulty that their frontline workers face every day, not having the right resources. The other thing that I don't have on this slide, but I'll just add to this line item about what child welfare should be doing and child welfare workers, think about the advantage that a frontline child welfare worker has over a homeless shelter worker in preventing homelessness. By the time they get to Tashira, they're already homeless, right? But child welfare workers, if they were armed with housing resources, could prevent thousands of children from ever entering a homeless shelter if we just gave them the tools to do homeless prevention. So we need to acknowledge their pivotal role, but also how difficult life is for them. The next thing is that states can use their child welfare dollars. So there's lots of talk about how inflexible child welfare dollars are. Not state dollars. That's decided by your governor, your child welfare commissioner. So we need to have the expectation that they use their child welfare dollars differently. And in Connecticut, they do this. They subsidize rent outright for families to keep them together and safe. Title 4E. So there's lots of talk about this federal line item that is locked in for foster care, but there are a number of ways to get flexibility. And we just finished a cost-benefit analysis, which I'll do on the next slide in a second, that shows people should use their waivers to just subsidize rent. We need to train child welfare workers on housing issues and get them the resources. I think child welfare workers know a lot about housing, but I think it's just frustrating because they don't have the tools to do anything about it. And then before I move on to the next slide, I'll just say we're not trying to turn child welfare into a public housing authority. We need to support our public housing authorities and all these other housing partners, but they do need to be expected to partner with them and lunch with them regularly and have a good relationship. So next slide. So this is from a cost-benefit analysis that we just completed. It'll be published, we'll call it in press. It'll be published this month or next. And this shows that if we use our Title 4E dollars, this is only for eligible families because not every family is eligible for Title 4E. If we used our Title 4E dollars, which is the federal child welfare line item under the Social Security Act, to outright get a family a 2-bedroom unit if they needed it, if we paid their rent for a year, per child we would save $12,179. Per family, we would save about $33,000. But what if the family needed a 3-bedroom unit? You would still save over $10,000 per kid and $27,000 per family. So we say even if it's just used as a bridge subsidy until you can get a Section 8 or more permanent subsidy or boost the family's income, just use that. Just use that. So next slide. So this is a list. It's not an exhaustive list, but a list of various housing resources. I won't have time today to go through how to use or access all of these. I'm really only going to talk about the Family Unification Program because it's a great model. But I will say this. Every year, the National Low-Income Housing Coalition publishes something called the Advocate's Guide. And in there, it's free, although you should make a donation, but it's free. They list every single one of these programs, how to get it, how it's funded, how the funding looks, how to lobby for it if you want to increase the funding or protect the funding, and so on and so forth. So while I can't talk about all of these, the information is widely available. And I should note that all the families I'm talking about are eligible for all of these funding streams. If they're not available in your community for these families, that doesn't mean they can't be available for them next year. All of these families that I'm talking about and youth can be prioritized for any one of these funding streams. It's all about building political will. Next slide. So just going to talk a little bit about partnering with your public housing authorities because it is the best model for how child welfare and housing can work together. And if you go to my website, which is on the last slide, you can pull down a kind of a graphic depiction of what this partnership looks like. So any public housing authority can set a priority code and set aside vouchers for any population you see fit, really. But there is something called the Family Unification Program where HUD provides vouchers specifically for families in child welfare who are either at imminent risk of losing their children due to housing problems or are unable to reunify due to housing problems. And if you go to the next slide, it's for reunification or prevention. It is also available for youth that are formerly in foster care or aging out of foster care who are facing homelessness. It is a local level collaboration between public housing authorities and their public child welfare agencies. Oh, I do have that slide. And it's designed to strengthen and stabilize child welfare families with the aim that they will be full participating members of the community and they will no longer need case management. But that having been said, for them to use this as a platform for stability, child welfare should ante up with plenty of case management dollars. Really, we think the research shows that's for about 2 years post-placement at whatever level the family needs. Next slide. I didn't realize I actually had this in here. This is great. So this is that graphic representation that I mentioned. If a child welfare agency is not able to fully support the family in housing with their own child welfare worker, they can hire, there's a purple bubble here that says supportive housing program. They can hire a community agency, community-based agency to provide the case management to help the family stay stable in their housing. And maybe for many African-American families, based on what the GAO study purports, that African-Americans are not very trusting of child welfare, maybe it makes sense to help use this model to get them into housing, but have the case management provided by somebody who's community-based, even if that's a local African-American congregation or a smaller program. But anyway, you do want to make sure that the family or the young person has adequate services to help them use housing as a platform to self-sufficiency and stability. So next slide. Final thoughts on where to start. Okay, I hate to say this, but nothing that I'm saying is new or interesting, okay, and none of it, all of it's been plagiarized from other people, okay, because for like 25 to 30 years, people have been coming up with great ways to figure this out. The Family Unification Program was first authorized in 1990, and the first vouchers went out in 1992. So it's not new, it's not exciting, it works, and I'm not sure that we need to pour more money into researching it. That is money that was better used housing people. And so go meet these people and see what they're doing. Illinois, Connecticut, California, Florida. HHS is currently running a demonstration program, and all of those people had to show that they had a history in doing this. And there's something like 5 sites doing it, and there's many, many more. You could reach out to folks all over the country and learn from their mistakes. Affordable housing dollars are flexible, and these are, as I said, these folks that I've described can be prioritized for these. You really want to do this through collaborations. They're the fastest way to get this done. I didn't talk any, and Jasmine will, I'm sure, talk about McKinney-Vento and the Hearth Act and the continuum of care process and where all of the homeless dollars are divided up. Every family that I've talked about, all the youth I've talked about, are all eligible for things like permanent supportive housing, McKinney-Vento money, and we go to the mat for that all the time. However, let's use our child welfare dollars in a smart way. Let's use our public housing dollars. We're not trying to drive these families into the homeless services system. We're trying to keep them out. And then you can always reach out to National Center for Housing and Child Welfare if you need follow-up information or anything like that. Always happy to help. And so with that, I'll hand it over to Jasmine.
Right. Thank you, Ruth. Again, thank you for inviting me to participate. I'm delighted to be here. By way of background, the U.S. Interagency Council on Homelessness is the federal agency responsible for coordinating the federal response to homelessness, and it's comprised of 19 member agencies. So our agency, the membership of the council, our meeting frequency, leadership rotation, all of this is governed by statute, namely through McKinney-Vento, which was reauthorized in 2009 as the Hearth Act. The Hearth Act also required the council to create a federal strategic plan to prevent and end homelessness. USICH worked with council agencies and numerous external partners. I'm sure many of you who are on the phone, if not yourselves, then certainly your jurisdictions, were partners in this plan, which is known as Opening Doors, and it was subsequently adopted in 2010 by the council. And so Opening Doors lays out, this really is our roadmap for joint action by all of our member agencies. It's the nation's first ever comprehensive strategic plan to prevent and end homelessness. I think many of you are very familiar with local implementation of the plan, and as it shows on the slide, we really have laid out very bold, very ambitious goals. And so within the plan, you see finish the job of ending chronic homelessness by 2015, prevent and end homelessness among veterans by 2015, prevent and end homelessness among children, youth, and families by 2020, and then really this is setting us on a path to ending all types of homelessness for all populations. In 2012, the plan was amended, and this was with a new emphasis, new strategies focused on youth who are experiencing homelessness. And so as amended, the plan identifies strategies to support the 4 key goals, and it's organized into a series of objectives. And this is really what serves as the basis for our council's work. So we implement the plan through several interagency working groups that are organized around the 4 populations of chronic homelessness, veterans, families, and youth, as well as through other interagency processes. And then we review the progress on opening doors through a review of annual point-in-time counts, as well as a performance management plan. And this is how we're tracking quantitative measures of impact as well as qualitative activity. And then annually, we provide an update on any amendments as well as action to Congress. In October 2014, Council approved a second amendment to opening doors. And this is significant, and this is largely due to our inability to get Congress to approve the investments that we felt are necessary to meet our goal of ending chronic homelessness by 2015. And so the amendment changes the goal of ending chronic homelessness from 2015 to 2016. It also clarifies the role of Medicaid in financing services to end homelessness. It adds strategies on the use of data to inform decision-making and manage performance. It includes an operational definition for the end to homelessness, and it provides greater clarity around retooling homeless services into a coordinated homeless crisis response system. So you'll see up on the slide, these really are the key themes across all of the work, and this is impacting all of the populations that we're targeting under the plan. So when we think about homelessness among families and children, and just, again, really building on what Ruth, I think, has laid out as a very comprehensive basis for today's webinar, we know that to successfully end and prevent homelessness among families, we've got to take a system-level approach on the families themselves. But one of the greatest challenges to ending family homelessness is that a community system has to be able to respond to both the housing and to the service needs of every family who's in need of services, regardless of income, household size, or any other barriers that they have. And so I think therein lays the challenge. And to be able to do this in an environment where we know rents are high, they're rising, there's limited housing stock, and all of this has to be then done within an environment where communities are forced to often prioritize or work with very limited resources. So what do we know about our families? We know that on a single night in 2014, over 200,000 individuals and families were identified as experiencing homelessness. This is just a drop in the bucket. It does not include our families who are living in doubled up or very precarious situations, which is, I think, what we know in child welfare to be the case for many of our families. We know that nearly 60% of these family members were children under the age of 18, which also reflects the vulnerability of the children who are in these families. And again, when we look at who's coming into our doors in child welfare and in foster care, we really see it's those young children under the age of 6, and then we have our very old, vulnerable older youth population. And then we know the vast majority of these families are headed by a single parent, predominantly a female. We also know that when we look at the families that are experiencing homelessness, and we look at then the families who are low income, there's a lot of overlap here. We see that they, in terms of limited income, they're very similar, exposure to and history of violence and abuse. We see poorer outcomes in the areas of health and mental health and overall well-being. And we know that these are families that have very limited supports, both formal and informal. And I think when we think about our families in child welfare, again, this is starting to be very similar characteristics. But then when we take a step further and we look at those families, and what is the difference then between a low-income family who does have housing and then a family who's low-income and who's experiencing homelessness? So we know that a lot of this has to do with lack of resources, has to do with life stage, and I'm going to build on what Ruth flagged, which is also about access to services, so particularly when we start to think about our families of color. So we know that we start to see even greater disparity. We see fewer economic resources. We see younger heads of households, many of whom themselves were involved in foster care or juvenile justice or some other system. We know disproportionate in terms of race. And I'm going to flag just as Ruth did, and I think that's an excellent point. When we say slightly higher rates of use of substances, really this is about lack of access to services that really are culturally competent, that are trauma-informed, and that are actually able to address the individual needs. So in addition to substance abuse, domestic violence, mental health challenges. And we know that these families also have increased rates of parent-child separation, namely involvement with child welfare. And this, again, is where we see the disproportionate representation of children of color in foster care. We also know through our research that there's a strong connection between child welfare and housing. We know that many of our children who now are experiencing homelessness were themselves in foster care, and that applies to both the parents and to our youth. We know that large numbers of adults who are experiencing homelessness themselves had histories of abuse and neglect. Whether or not they had formal involvement with child welfare varies, but we know there's trauma there. We know that between 2011 and 2013, for approximately 10% of children entering foster care, inadequate housing was selected as one reason associated with their entry into foster care. So when we look at defining an end to family homelessness, we know the work to be done is significant, and this is both in terms of mitigating the risk factors to support families that become involved with child welfare, as well as preventing families from experiencing homelessness and becoming involved in the first place. So we have to look at both prevention as well as intervention. And so this really is a coordinated response to family homelessness, which means working across federal, state, local levels to strengthen both the homeless services side as well as mainstream resources, and that includes child welfare. So I'm just going to go to the next slide. Back in February 2014, the Council released Family Connection, Building Systems to End Family Homelessness, and this is a resource aimed at expanding effective partnership with communities across the country. And the intent here is to really start to have that cross-system conversation to bring people together. Ruthie talked about the continuums of care. The only way that we're really going to advance in addressing the needs of families is to have a multi-system intervention or response. We know that the very small pool of resources for targeted housing assistance are not going to do this on their own. It has to be part of a larger network of support. So Family Connection is designed to help build those resources, to help give communities the tools they need. It includes information about how you implement a lot of the policies that are articulated in the document. So there's resources available now, and then additional tools that will be coming out. So the key strategy areas that Family Connection highlighted, these were developed through a review of research, a lot of engagement on the ground with communities, and then through interagency work. And so the four key areas that have been identified is, one, developing a coordinated entry system. And so this means having the capacity to assess strengths and needs and connecting individuals to targeted assistance where possible and to the temporary shelter that they need. It means every family within a local system should be assessed if they present for having a need for assistance. It also means ensuring that those interventions and assistance are based on the unique needs of families, and that we have to move away from, unfortunately, what becomes very much a cookie-cutter approach. And that happens, I think, when you're in an environment where you're constrained by a lack of resources and a lack of an ability to really try and be innovative, out of the box, and think about the flexibility that potentially exists with both resources and with funding. And so then that helps us to think about the third key area, which is the linkage to local mainstream resources. By doing this, by helping families connect and access benefits, employment, community-based services more quickly, we really then have an opportunity to support those families and build upon the existing homeless services. And all of this is being done with a view to look at what's currently known in terms of evidence-based practice for serving families. We know there's a lot we can learn from the interventions on the child welfare side, and so we can begin to build on that. I'm going to spend a little time talking about coordinated entry systems, because for those of you that are participating on the webinar who come from the housing side, this will be more familiar to you. I think, though, for child welfare, when we think about our local systems of care, this is really the same idea, bringing multiple systems together. So coordinated systems hold promise for communities, and this is both for streamlining access to housing and services, as well as ensuring that assistance is targeted appropriately based on, as I said earlier, on the needs and strengths. Equally important, we know that coordinated entry systems have the potential to create opportunities to leverage and connect mainstream services. So this can take two forms. Where you have mainstream and non-targeted programs like Medicaid and housing choice vouchers, they can play a greater role in providing targeted interventions like permanent supportive housing. And coordinated systems can facilitate alignment of eligibility determination processes between homeless systems and mainstream systems. It also helps us to facilitate referrals to and from mainstream systems like schools, certainly child welfare, and when we think about the population of our young people, we know education is a critical partner in this work. We also need to look at our workforce systems. There's a lot of opportunities under the labor side. We've got TANF as well as others. These are all systems that can help to identify households who are experiencing homelessness, who may be at risk of becoming homeless, who may be at risk of becoming involved with the child welfare system. And there's the opportunities now to start to connect these families with those services that might prevent some of that more in-depth engagement with some of these other formal systems. When we think about, you can go to the next slide. When we think about a coordinated entry system, this graphic is meant to show how the intent, certainly from the homeless assistance side, is to develop a system where no matter where an individual or family comes into contact, whether it's with the mainstream and public system or with the housing, that there's an ability or a mechanism to immediately link them to services. So from the child welfare perspective, we think about ensuring safety and well-being while solving families' housing crises. So we know that when families come to us, they have varying levels of strengths and needs. And an effective response addresses that immediate crisis of homelessness, and then it connects families to the most appropriate level of assistance based on those needs. We know that having appropriate assessment tools at the front end is critical. Again, child welfare has been doing a lot of this work around looking at trauma-informed assessments and really being able to identify what is it that that family needs to support them. Prevention and diversion. As a result of assessment, families could be assisted to maintain or obtain permanent housing while avoiding a shelter stay. I think we hear a lot in child welfare about sometimes the frustration on the side of workers of feeling you've got to bring a family into the system in order to access services, or you've got to maintain a case, keep the case open in order to continue the provision of services. We know that through reassessment of our resources, if we're able to really streamline and we're able to target appropriately, we should be able to close out our cases. We should be able to move families to stable housing, to stable supportive services through mainstream resources, and mitigate the risk that we have of prolonging their involvement, both for the parents as well as for the children with child welfare. We know that safety for survivors of domestic violence is critical, particularly for our families who are involved with child welfare. And so this means that providers may need to look at their admissions policies. They may need to look at, are there any barriers to entry that are embedded unknowingly in their eligibility criteria? And we also know that just as families who are experiencing homelessness and are involved with child welfare are significantly impacted by domestic violence and trauma, other systems have training and they have the capacity to engage in a trauma-informed way. So these are systems that are able to offer safety planning, advocacy, and access to specialized services for families. So why a coordinated approach? We know this makes sense. So just as communities are building local systems of care that bring together health and human services, coordinated entry systems for the homeless services system is an opportunity to leverage mainstream resources and bring everyone to the table. It supports increased and streamlined access to housing and supports. And we know in child welfare the most effective case plan is one that's coordinated across multiple service providers and systems that the families are involved with. Working in isolation is not going to get us the results that we're looking for. So when we think about connection to mainstream resources, our long-term outcomes are only going to be sustained when the resources that support housing interventions are there. We know that simply looking at homeless resources is insufficient. We have to think about developing strategies to improve our access to in coordination with mainstream housing. So it's a little bit about the public housing that was talked about earlier. I've already talked about the schools, early childhood education, home visiting, workforce programs, other non-cash benefits. All of these are part of that safety net for the public, and these are services that our families should have access to. The next graph is just a visual, and this is just, again, just to reinforce the importance of mainstream programs in addressing the needs of families experiencing homelessness. Right on the left, we see targeted homeless programs. It's a very small, when you think about the big pie, it's a very small piece of the pie. These families need access to these additional services. And by bringing folks together in a very coordinated way, the continuum of care has an opportunity to have all of these different systems around the table, and we can begin to look at how do we leverage some of these resources so that we are tailoring our response and prioritizing to those most in need of services. And so the tailored intervention and assistance approach. So this means moving away from what we talked about earlier, moving away from a cookie cutter approach to service delivery, and really assessing what's going to be most impactful while really respecting and being mindful of the choice and the voice of the client within an environment that also has limited resources. So again, thinking about what we do in child welfare when we're determining the kinds of services or resources that children and families need to achieve their goals, it means that for most communities, we need to think about providing rapid rehousing. There's resources for that. So for the majority of families experiencing homelessness, rapid rehousing is a short term to really get them on their feet. And then we think about affordable housing, and there are resources to support these families long term. Permanent supportive housing, we know that this is for our really vulnerable families. I'm probably going to skip through and mindful of my time. And I think most folks on the phone. So I want to focus a little bit on the permanent supportive housing. We know that this is most effective for our families, particularly those with the highest needs and greatest barriers towards obtaining and maintaining housing on their own. And there are opportunities. HUD has issued a notice of prioritization in which eligible households should be served in all continuum of care program-funded permanent supportive housing that encourages priority be given to families who are most vulnerable. Transitional housing, there are a few families for which transitional housing is appropriate. I think in the child welfare context, for the most part, these are for families who may be in recovery, exiting family drug courts. And this really is designed to aid the movement of families to permanent housing within 24 months. And similar to rapid rehousing, transitional housing can include supportive services, and then rent can be used to help participants move into permanent housing. Affordable housing, these are just a couple of the examples. I think it's really reiterating the importance of partnering, cross-system collaboration. We know that, again, we cannot solve family homelessness just with resources targeted to the homeless, but we need to access all of those additional resources. And there's research base building on Ruth's presentation that suggests a housing subsidy is one of the most effective interventions in helping a family to exit homelessness and to stay out of homelessness. And so I would say over the past several years, there has been really increased collaboration between the local continuums of care and the local public housing authorities. And through the recent competitions issued under HUD, continuums of care have had to demonstrate how the public housing authorities are active members in that continuum, whether that's preference for homeless populations or if they are actively seeking referrals from some of the systems that serve families that many of us work with. Okay. And so building on evidence-based practice, we know that there's a lot of discussion, especially in the child welfare field, about what works. How do we know what works when it comes to the intersection of housing and child welfare? So we know that child welfare systems are challenged when it comes to responding to the needs of homeless families. Ruth has talked about that. There's the issue of time. We have ASPA guidelines, which are really driving our work. There's the issue of services. So if we identify the services a family needs and we can't access them because they don't exist, that adds to the challenges that we face. So that really is talking about the dearth of affordable housing. And we know that there's a range of family needs. So while families may be facing homelessness, many of them are caught in the cycle of poverty. They have challenges with mental illness, substance use, trauma, and domestic violence. And then what we have, until we get to the place of really a coordinated entry system, we have a lack of system integration. So trying to integrate child welfare, housing, along with all of the other critical supportive services is what we need to have happen, and that's really now where states are starting to struggle and starting to work. So we have, through child welfare, we have partnerships to demonstrate the effectiveness of supportive housing for families in child welfare. And these are, I think, what holds most promise, or certainly great promise for us as we begin to really look at interventions with families involved in child welfare. There are 5 sites, and over the next 5 years, these are grants that are really going to examine and further the efforts of CPS to reduce family separation due to the lack of adequate housing. And so over the next year, there will be a lot of information released in terms of evaluation findings. These sites have finished their first year of planning, and they're moving into their year of implementation. So I'm going to speed through. So these are just some resources that we have online. And we will also be disseminating a lot of information about the Child Welfare Demonstration Project. So with that, I'm going to hand it over to Shira.
Thank you very much, Jasmine. Thank you to Jasmine and Ruth for such great presentations. I will be giving a local perspective to today's webinar. As Jasmine mentioned, my name is Tashira Halyard. I'm the Deputy Director at the Homeless Children's Playtime Project in Washington, D.C. Our mission at Playtime Project is to nurture healthy child development and to reduce the effects of trauma among children living in temporary housing programs in the district. We were founded in 2003, and at that time we were a volunteer-led organization serving children in shelters, and we've grown to a staff of 12. Half of our staff supervise our play programs, and those are 18 weekly programs at 5 sites throughout the city. One of our sites is actually the city's largest emergency shelter called DC General, and we also serve 4 transitional housing programs. Last year, 600 children came through our doors at Playtime Project, and we trained over 465 volunteers. Before I talk specifically about our model, I want to talk about family homelessness in D.C. We know that families experience homelessness in D.C. At a high rate. They are 54% of the total homeless population in the city. They're known as the hidden homeless because we don't often see families sleeping on park benches. As of April of this year, 1 in 20 DCPS students were reported to be experiencing homelessness. That number is actually probably greater, being that families are at times hesitant to self-report that they are facing housing instability. Also, it should be no surprise in light of the national data that Jasmine just mentioned, nearly 43% of families who entered shelter in D.C. last winter were headed by a parent 24 years old or younger. The majority of those young parents lacked a GED or a diploma, and it was also their first time seeking housing independently. Nationally, I should also state that according to AIR, mothers with a childhood history of foster care involvement are more likely to become homeless as adults and also to face homelessness at a younger age than their counterparts who were not in foster care. In D.C., families have the right to shelter only when the temperature is freezing. I'll speak on the next slide about some of those drivers into the shelter system into the city, but I should definitely note that if it is above 32 degrees in the city does not have the obligation to place a family in shelter despite their circumstances. Our largest shelter, DC General, is currently full, housing 296 adults and 469 children. The city's actually contracted with at least one hotel already this hypothermia season to place those families who no longer will fit in the shelter. And 98% of the families we serve are African American. As I mentioned on the left on this slide are some of those drivers into homelessness. I won't get into every area, every bubble that's listed there, but I do want to highlight housing costs because I'm sure many of those folks who are dialing in today know about the high cost of living and the rising rates of rent throughout the country. D.C. has one of the highest costs of living in the nation, and currently a family must earn about $30 an hour in order to afford a 2-bedroom apartment in the city, which can be a huge barrier for some of our families. So if a family is seeking shelter, what happens is that they come to our central intake center known as Virginia Williams Resource Center. As I mentioned, if the temperature is freezing, then those families have a right to shelter. They're placed either in the emergency shelter or they may be placed in a hotel given what time of year it is. If it is not freezing outside and there is no emergency shelter space, and those families may be forced to go back to unsafe living conditions or to ride a bus all night, to sleep in a train station, etc., because of a lack of shelter space in the district. Homelessness is obviously a struggle for anyone, but I want to speak today about some of the challenges that homeless children face specifically. Just a glimpse of some of the national data. By age 12, we know that 83% of homeless children have been exposed to at least one serious violent event. In D.C., a point-in-time survey this year by the D.C. Coalition Against Domestic Violence showed that 44% of homeless families have reported a history of domestic violence. So it's no surprise then that children who experience housing instability are sick more often. They go hungry at a higher rate. They are 3 times the rate, half 3 times the rate of emotional and behavioral problems. They're more likely to show signs of delayed development or to have learning disabilities. And they also suffer in school. They're more likely to repeat a grade, be expelled, get suspended from school, or drop out of school. I want to take a moment to highlight the statistics about illness and developmental delays, because we see in our program that families have become disconnected as a result of homelessness from their primary care providers. And for folks on who are dialing in who have children or who work with young children, you know that for when children are young, it's necessary for them to be connected to the primary care providers, because those are the people who are able to assess their developmental milestones. It's not just about when they're sick, but the doctors can tell you whether or not your child is developing appropriately. And homelessness at times can disconnect our families from doctors. The stress of homelessness on children can be great. As a matter of fact, when children are stressed, we know from brain science that cortisol floods their brains, and it floods the brain hippocampus where learning occurs. As a matter of fact, too much stress is known as toxic stress, and that's considered frequent and or prolonged periods of adversity. And according to some of the research that's happened at the Harvard Center on the Developing Child, this toxic stress can cause lifelong physical and mental damage. So what can we do about toxic stress? Well, toxic stress we know can be alleviated by stable relationships with caregivers, and also one of the antidotes for cortisol is serotonin. And serotonin is released through physical activity, laughter, affection, mastering new skills, and also rest. And I want to take a moment just to reflect a bit here, because as we've mentioned throughout the statistics about parents being very young as they enter shelter or having a history of domestic violence, it can be difficult if you are placed in a shelter environment or in a hotel with multiple children trying to interact and to facilitate physical activity, for example, the children mastering new skills, even just rest. We have families as many as 6 children placed in a room with 1 adult. And so that's why playtime exists as an intervention. We know that brain science and experience tells us that play is vital for children's healthy development. As a matter of fact, that's simply how children learn. They gain social and emotional skills. Their executive functioning skills are sharpened, those skills that can be compromised from toxic stress especially. They also gain academic skills such as creative problem solving, language enhancement, math, etc. And our playrooms exist to provide children with a dedicated space, time, and attention to build resiliency so that they can bounce back from the traumatic event of homelessness. Getting deeper into our model, we have evening programs that are led by staff and a team of trained and supervised volunteers. We serve children from infancy all the way to high school. And if I can take just a moment to talk about high school, if families are known as the hidden homeless in the district and possibly in the nation, I would say the homeless teens are the invisible homeless, and largely they are less likely to self-report that they are homeless because of the stigma attached to it. They're ashamed. They don't want their peers and their friends to know. We actually are working now with a young man to get him re-engaged in school, and although he loves school, the reason that he says he dropped out was because he didn't have money to afford the uniforms. Well, McKinney-Vento is a federal legislation that should help with uniforms for kids in school, but again, if they don't want to say that they are homeless, they can't access that service. Something as simple as doing school projects or science fair projects or writing reports for papers, this ability becomes severely compromised if you were in a highly stressful shelter environment with you and your siblings and you're trying to focus on school. For folks who want to know more about the struggles faced by homeless teens, Helpline released a very interesting article last week that I encourage folks to read. Getting back into our model at Playtime, it's a mix between guided activities that coincide with monthly themes and free play stations each night at our program. Our curriculum is informed by child development research, which we think is vital, and also the Common Core standards for our older children as we focus on math and reading. We refer families to supports and services, things like home visiting programs, child care, employment services, helping families to get furniture as they move out of the shelter. And also this year we concluded a parenting class at the city's emergency shelter using ACT's Parents Raising Safe Kids curriculum by the American Psychological Association. And we're hoping in the spring to bring some mindfulness and meditation classes to some group settings for parents at the emergency shelter. So speaking about trauma, which I know was one of the points that Jasmine made earlier, we know that our families have faced at least one traumatic event, and that is the trauma associated with homelessness. Therefore, it's our responsibility to keep that trauma in mind as we're engaging with our children and with their parents. So our programs are designed from that guise. Instead of asking what's wrong with you, we believe it's our responsibility to ask what has happened to you, and those things then guide our playroom expectations. For example, we use positive language. We always give our children choices. With the word gap in mind, it's vital that we narrate play to help give our kids to expand their vocabulary, give them greater language. We carefully plan transitions. We enforce natural consequences. I won't get into all of these, but I will stress that we see it important for us to work on de-escalation techniques to teach children in environments that can be like pressure cookers how to bring down their heart rate and how to de-escalate. So that's Playtime Project. If you all would like to learn more, please visit us at playtimeproject.org. You can also visit us on Twitter at Project Playtime. I highly recommend it if you want to see our evening programs with some of the cutest kids in the world. They are on our Twitter feed. Also, I can be reached for questions or comments at Tashira at playtimeproject.org. I'll turn it over to Arande.
All right, thank you, Tashira. And actually, I'd like to say thank you to each of our three presenters today. This has been, I think it's been very informative, both from a practice perspective and from a policy perspective, and then especially understanding what this experience is like for children and to some extent their parents during this transition period. And so I want to encourage everyone who has a question to submit your question. You can use the question feature on your GoToWebinar control panel. And so I actually just want to, and we have the benefit today of having each of our presenters here in the room here at CSSP, and so we're fortunate for that. I actually want to start by just posing a question to maybe a few of you all, whoever wants to start. But there obviously are a number of jurisdictions, and so I say jurisdiction, states or local places that have been doing this work, that have been in some ways maybe innovating, but who have been testing out and actually implementing some of these strategies. So I'm curious, given that it's not just about the leadership in one particular agency or institution, what tends to make the difference in those places where they have presumably leadership from a few different systems that understand and appreciate what the challenge is and are working together. But can you offer some insight on what makes a difference in these places?
So I think there's a couple of things. I think one, so the number one thing I would say is the will, so having leadership. I think it's also having access to not only resources, but access to at the community level. So I think it's about being able to bring systems together. I think it's about having flexibility in how resources are being utilized. I think whenever we have an opportunity for demonstration projects where communities can test out whether there's flexibility either in eligibility in programs or flexibility in how real funding is being used, the ability to braid or blend funding, I think all of those factors contribute to being able to advance some of these changes that we're talking about.
Okay. All right. Thank you.
This is Ruthie. I'm with Jasmine. I think it has to do with leadership and people that take the license to do these kinds of things. Mark Testa comes to mind, Mark Cherna, Nick Scapetta, who was in New York City, brought in the New York City Housing Authority and ACS together to share resources, and because of that, they have priority codes for Section 8. They have a housing unit within ACS. So I think it really is, it's political will. It's like that person that really takes this on. But, you know, I do have to say a word about widening the audience for this, right? So not through the media, not through sensationalist child welfare stories, nothing like that, but getting like Mimi Laver at the ABA has something called the Parent Representation Project. So getting the attorneys involved, asking great questions, getting more resources to the table. So I think widening the circle and the audience on these things, getting new people to the table. So, like for example, that GAO study where they don't raise housing as a solution to housing as, you know, not having housing as a problem. I think it's because the epistemic community is too small with all child welfare people. You need to get housing authority directors, mayors, you know, folks that run things like the Children's Playtime Project, things like that. Widening the audience for this is really important.
Thank you. Thank you to both of you. One question for Tashira. Can you say a little bit more about the implications for your workforce, for your staff, in terms of understanding the experiences of children, the experiences of their parents, toxic stress? So how do you build that into your preparation of your staff and your workforce?
Thank you, Arunde. I think it's very important. As a matter of fact, I've been working on our training calendar for 2015, and trauma-informed care, cultural competency, all these things are at the top of our list, as well as an understanding of early childhood development research, because so many of the children we serve are very young. We know that their parents are young, meaning the children that we serve are young. So it's important for our site managers to go into program each night with an understanding of the demographic that they're serving and see playtime as an intervention that is meeting their needs.
Mm-hmm. All right, thank you. Another question is, and it's actually related, and so it has to do with the developmental experiences of children, but particularly as they're going through this transition with their families. Do you all know of any efforts or examples of efforts where they're actually engaging the schools directly so that the schools understand what's happening with the families and they can be in touch, in tune, and responsive as well?
So there are examples, I think, of where schools have built strong relationships with the local continuum of care, or with, and then within that, with the local shelters. So we can certainly provide those examples. I know Chula Vista in California, I think, is one that comes to mind, where they have a strong relationship between the local school and the shelter in terms of building a relationship.
Okay.
Well, and federal law requires that there's a McKinney-Vento liaison, which Tashira mentioned. These rights are afforded to homeless youth who are trying to go to school and need resources and tutoring and things of that nature. There has to be a McKinney-Vento liaison, and those people are a lifeline to both homeless youth and to foster youth. So as that relates to child welfare, the youth in foster care did not have that same set of rights, but the Fostering Connections to Success Act added foster youth to they have McKinney-Vento rights now. So, yeah.
Okay. One of the questioners asked if you could say a little bit more about, so I think you all mentioned a few places that have been somewhat innovative or at least have taken the lead in developing some of these strategies. Can you take a couple of those and share a little bit more about what they're doing?
So I can give the examples of the different housing grants. And so this would be in Cedar Rapids, Iowa. What they've done is they've had a really strong partnership with their local housing authority, and they were able to get a commitment of actual housing vouchers. And then in addition to that, local dollars were leveraged and put into a trust to help subsidize the rent for 1 year for families. So that's one example. In Memphis, they've also built a really strong relationship with, again, between child welfare and public housing. So I think these projects are an opportunity for child welfare and public housing to come together and really help to, so one of the challenges was when these grants were developed, applications, they required a commitment of housing resources. Of course, this was in 2012, and then the economic downturn hit, and so a lot of the commitments, unfortunately, were not able to be honored. So what it's meant was those sites then had to go back and be really creative in how they identify housing to support families. So I think those 5, which now there's, as I said earlier, they've finished their planning year. They're now in the very beginning stage of implementation. But through this effort, they have already been able to help house a number of families. And now what they're looking at is, okay, so traditional services, maybe it only lasts for 18 months or 24 months. What's going to come out of this grant is the determination about whether families who are involved with child welfare require a longer period of intervention while they're getting their housing subsidy, so that we know we can sustain or maintain the change for them.
Okay.
And so over the time that there's been something called the Family Unification Program, there's been over 330 public housing authorities that have partnered up with their child welfare agencies, and I think it's over 250,000 children have been reunified through the program. So there's a long, rich history, and the research does show that a year to 2 years after, they are still safely, permanently housed with those vouchers. So we really think the gold standard here is an ongoing public housing subsidy, and we need to figure out a way to make that work.
All right, thank you. Thank you both. Another question that came in is asking if you could discuss some of the particular ways that these dynamics play out with formerly incarcerated parents who are coming out and reconnecting with their children. At least what some of the complicating issues are, perhaps?
Well, I'll take a stab at it. One thing that's great about these relationships is that housing authorities don't have to bar people from public housing resources because of their rap sheet, we'll say, but often they do. But if you have a relationship with them and they are aware that you're going to be providing a family with services, they will allow a family to get a Section 8 voucher, or they'll move them into public housing. So a lot of people that are in communities where they think that public housing is not an option for families coming out of the prison system, they need to get their director out to lunch with the director of the Public Housing Authority, because they can remove barriers that are in their regs, because their regs are driven by their board of directors and themselves. But also, it really there's another problem there. It's not just getting a subsidy or someone to pay for the rent, it's getting them into the housing, right? So if you run someone's police report and then you have to present that to a landlord, that can be problematic. But again, it's not just about building a relationship with public housing authorities. You have to go out and get a landlord liaison who can gin up interest among landlords. And I would say the state of Connecticut has a nonprofit called the Connection Incorporated that has a former realtor on staff that goes out and engages landlords, and so they have apartment complexes in beautiful areas all over the state. They rent to people, but they rent to them because of the relationship of the nonprofit that has developed, the reputation of that nonprofit that developed the relationship.
All right, thank you. I'll also encourage, if people have in these last few minutes any additional questions, then please send them in. One of the questions came in just asking for some ideas, and maybe this is at the national level, maybe this is also at the local level, but just any ideas about strategies for increasing awareness about what these different options and opportunities are to connect families to housing. And so I'm thinking within the context of, to some extent, maybe it's, social workers, caseworkers, supervisors, but people who really don't know about a lot of these opportunities.
So I think the Family Connection that I highlighted earlier is one great resource for communities. I think now having webinars like this is great because it helps to communicate the messaging. HUD's requirement or expectation is that local continuums of care are engaging with other systems. So that's another way, so that it's not always on child welfare or on the schools to be reaching out, but that it's also, there's an expectation that the homeless services side is doing that. So I think it's both at the federal or national level of widespread communication, taking advantage of listservs across different agencies, and then all the way down to the local level where it's really your continuum of care, but then supported through other systems as well.
And there were a couple questions, so I'd like to let everyone know that we will be sharing the slides. There were a couple references to resource guides, and so we'll make sure that we collect as much of that information as we can, and we'll make sure that we send the links to them if they're online. If they're not online, then we'll try to gather them and send the PDFs so that people can have access to those. And so just want everyone to know that we will be sending those within the next day or two. And so we also want to do that along with the link to the webinar recording. Just given the time, I actually just wanted to take a few minutes and ask each of our panelists if they wanted to share any final remarks, reactions to other things that they've heard, or just things that have not been stated already, but you just want to make sure that people are aware of, or just reiterate so that people walk away having a full appreciation of. And so we can, I guess, go on the same order and start with Ruthie.
Oh, okay. Well, I actually, Tashira, I read about the Homeless Children's Playtime Project in the Post all the time. I think everybody here is a fan, but I've never seen an actual presentation on it, and so I want to thank you for that. That was really, really interesting, and like a little depressing too, but also upbeat, nice mix. So thank you for that. I don't know. I guess I would leave. I would leave you guys with this final thought, and that is that the United States does have an affordable housing crisis. I'm not unaware of that, but there is a lot of housing money exchanging hands. There are cranes going up. There is affordable housing being built. We just found out that the National Housing Trust Fund, which you should look that up, it's going to be in the Advocate. It'll be in the Advocate's Guide that we're going to share with you. Is going to be funded in January. We just got word of that. So I think that we have to have a lot of hope when it comes to housing. We have to have the expectation that families in child welfare, their advocates can get a seat at the table and free up resources for them.
Thank you, Ruthie.
Mm-hmm. And I guess for me, it would be just reiterating the message around coordinated entry systems and cross-system collaboration, that this is not just a child welfare issue, it's not just a homeless services issue, but that this is across the board. There is an opportunity for all of our systems that touch our children and families to be at least aligned in a way that makes sense for our children and families.
Thank you.
And I think I would add to the point that I think Ruth made about there needing to be a political will and a shift in the way systems think about working together and coordinating their efforts, that we can't forget about the power of families themselves to share their stories and to be their own advocates. Large data sets and GAO reports are so important because those are the things that drive public policy, but that those anecdotes and qualitative research is so important because it gives a true picture for what homelessness looks like in our country, especially family homelessness that can go so hidden.
All right, thank you. Thank you again to each of our presenters, so Ruth White, Jasmine Hayes, and Tashira Halyard, and actually everyone else online for all of your interest and involvement in this conversation about improving the connection of families to housing supports. as a part of this broader effort to reduce racial disparities and disproportionality in terms of families involved with the child welfare system. So thank you all again. I also want to say thank you to the team here at the Center for the Study of Social Policy, especially Amelia Essenstad and Jonathan Likes, both of whom helped pull today's webinar together. And also many thanks to the Annie Casey Foundation for their continuing support of CSSP and the Alliance for Racial Equity in Child Welfare. Please look for an email from us with a link to the evaluation survey, as well as a link to the online recording of today's webinar. And if you don't currently receive Alliance emails directly, you can sign up at cssp.org and visit the Alliance for Racial Equity in Child Welfare page under the System Reform tab. I want to say thanks again to everyone for joining today's webinar and also for joining all of the webinars this year. We look forward to working with you, talking with you all, and sharing more information with you all as we enter the new year, 2015. So thanks again, and be well and happy holidays. Take care.